Welcome to this session on research, looking at the gap between research and practice. And thank you, Janaki, our moderator, and Dr. Sadhana Nathu and Dr. Bobby Zakaria for participating in this discussion. I'll introduce Janaki, and Janaki will introduce the speakers. Janaki is a founding member of SHP Social Foundation, an organization which runs an emotional helpline with the help of volunteers. She's an HR professional from Tata Institute of Social Sciences and founded the SHP Social Foundation to work on various aspects of mental wellness, providing safe spaces for persons to share their problems, find clarity, courage, and direction. It's the primary purpose of Listening Post, one of the flagship programs of the foundation. She works closely with corporate HR on diversity and sensitization training, that is gender and disability, and to help create the new healthy professional workplace. Young adults, children, and women are the focus of many of her initiatives. Through the SHP Social Foundation, she has designed programs for senior citizens and home caregivers also. Janaki is also on the board of trustees for Bharatiya Samaj Seva Kendra, or BSSK, an eminent institution in Pune in the area of childcare and adoptions. Thank you, Janaki, for moderating.
Thank you, Aditi. Can you all hear me? Yeah. Thank you, Aditi, for your kind words. And thank you also to Connecting Trust and Aditi and Sandy for putting together this safe space for conversations that we've been able to have over the past 3 days, 2.5 days. But it's an amazing collection of people who are coming together to have this conversation. Thank you for giving me this opportunity as well. To get it started, let me introduce co-panelists, Dr. Bobby Zakaria and Dr. Sadhana Nathu. Very briefly.
Hi, this is post-lunch, so...
So very briefly, I'll just read out a bio of both my panelists. Dr. Bobby Zakaria is an academic researcher and mental health professional with a PhD from VU Athena Institute, Amsterdam University, now actively working in the field of corporate social responsibility. Bobby brings over 3 decades of experience in mental health, psychology, resilience building, and both his academic background and lived experience. As a SALT practitioner, SALT is support, appreciate, listen, and team. As a SALT practitioner, it's a SALT practice that forms the foundation of all his work across diverse fields, inspiring his community engagement work, known for integrating evidence-based approaches with compassionate care. Bobby facilitates dialogue and collective action to challenges that cause human suffering. I've known of Bobby working in disaster zones and many places. Many of you know Bobby well, especially the connecting team will know Bobby very well. Moving, welcome Dr. Bobby, and hope we will have a fruitful dialogue. Moving to Sadhana Tai. She objects if I say Sadhana Ji. So moving to Sadhana Tai. She's an academician, researcher, author, psychotherapist, advisor to NGOs, corporate sector, former executive committee member and current social action policy committee, member of National Academy of Psychology, a POSH trainer, external expert on POSH, gender psychologist with grassroots to global experience in multi-sectoral work for over 35 years. So that is Sadhna Tai. I've known her work in the interdisciplinary field of socio-psycho field work, especially action-based field work. So wonderful to have this conversation with both of them, and glad that the scientific committee thought that a session on the gaps between research and practice is essential part of this dialogue, and I'm so happy to take it forward. So to start with, I would just like to ask both Bobby first and then Sadhna ji, in terms of this whole conference is called What Are We Missing? So in terms of bringing the context back to research and practice, and in terms of what has come up in the last 2.5 days, what is missing really in research and practice, and what are the emerging areas that have come up in these conversations?
Thank you, Janki. Thank you, Janki, and hello, all of you. Good to be with you. When that question comes to me, I'm thinking about a situation where we were sitting. When we say we, as a part of the connecting team, we were sitting in one of community discussions, which is not very far from here. And with the community members, we were doing a mapping, trying to understand how many people have died with suicide here, how many people have attempted suicide, how many people are doing self-harming behaviors right now. And when the community was putting everything on the map, saying that the people who died with suicide are these 15, those who have attempted suicide are these 38 people, those who are currently practicing self-harming behavior are these 45 people. And when the community saw all of that, right in front of their eyes, for them to kind of look at, now what does this mean for us into the future? It's one thing for us to, as a community, to come to this stage where we are able to acknowledge openly about our own lived experiences of our family members dying with suicide, some of us having attempted suicide and sitting in a discussion like this, some of our family members who are practicing this kind of behaviors right now. So we have traveled a journey till now, and we are now able to name the risk factors which is putting us at risk. For example, in case of our women, it is domestic violence and alcoholism. In case of young people, it is relationship issues. We are not able to understand how to relate with the people of opposite gender. So we are able to acknowledge all of this, and having to deal with people in the systems. When a suicide happens in our community, the police lands up at our door, and the kind of questioning that they put us into, that's very traumatic for us, because we have already lost a family member to suicide, and they interrogate us with the intent that as if though we have murdered our family member. For the hospitals, when we have an issue, when we go to the hospital, and in the hospital we now come across nurses and doctors who have a very stern face. There is no compassion on their faces. We have to get treated, and they command us around. All of these things are going on. And again, some of us study in colleges. Some of our classmates are going through these kind of issues. And when we try to speak about this in our college, in our setting, the counselors seem to be quite busy. And if we go towards that direction, then we are looked up with stigma. इसको कुछ पागल है, इसलिए उनके तरफ जा रहा है. So all of these situations come up, these are all real situations. So having to map it, having to speak about it, bring in the lived experience of people into this kind of research setting, trying to remove the stigma, bring about the safety that even police officers, when we speak to them, for them to say that, we are also human beings. We have been given a task that every death, unnatural death which happens in the community is a murder till it is proven otherwise. So we have a responsibility to investigate it properly. We know that it could be a suicide, but we will not start investigating upfront as a suicide. We will start from the angle of murder and rule everything out before we come to the conclusion that it is suicide. When we speak to the hospital staff, for them to say that we are trained in nursing care, in treatment, when somebody comes with these kind of deep injuries on their neck, on their stomach, limbs cut off because they have jumped in front of a train, or they have drank poison or acid when all the internal bowels have been burned out. When they come with these kind of situations, if we are going to be compassionate, and if I am going to show sympathy to them, I will not be able to do my career for long, because on a daily basis I see 2 or 3 people coming like this into the hospital. So I am required to kind of keep my professional stance and do my work, because that's more important than showing compassion. So there are many situations, many things like this which has to be brought into a research question, as well as the research questions is then translated back into the practice as well. Both are important.
Yeah. Okay, so before I jump in to answer that question, I want to make 2 quick points. One is that from a Marxian framework, theory, research, and what in Marxian writing has been called praxis, and not practice. So praxis is where the theory, the research which is grounded in lived experiences from the field then becomes a praxis. So it is a very informed act, and in gender studies we say theory, research, praxis, all are a continuum. Now then, why the gap? Okay. So the gap is with, how many sitting here are from psychology? Please raise their hands. Yeah. And the others are, I guess, from various other disciplines. So now why, because I wear many hats, so I'm going to use that to my advantage here. Why are these so-called glaring gaps? These gaps in what is practiced on the ground and what is happening in theory and research in academia or in training is in mainstream mental health and psy disciplines. So what I call mainstream psychology, and that's the way it's taught across India, barring a few departments. Now he comes from a social work background and he's shifted to psychology. So that's where those concerns have been brought into the academia and the research. So what has happened in these mainstream disciplines, they have remained, again, how many of us were there for Raj Mariwala's, so I come from that similar kind of thinking. So Sandy told me, wow, this is straight up your alley. Yeah. So I don't know how many more people found it, except one of my students is sitting here, so she's nodding. So mainstream psychology research or theory, barring few exceptions of course, with due respect, has not shifted. But let me tell you, there are other kinds of critical disciplines where the research has always been field research, action research, across communities of all types. So whether it is trauma from wars or people living right here in this city, the urban poor, who are a large number, and the work that has happened with them, the kind of research which then informs theory. Okay, so that work, then where has this happened? Which disciplines are we talking about? So this has happened in gender studies, public health, something that I come from, which is feminist psychology, okay, community development, social work research. So first of all, there is research and there is research. It's not of a kind only, but we have this tendency of generalizing. That all research, yes, a large part of research is very ivory tower. And if I have to use examples from psychology, the people sitting here, it will resonate. It is independent variable, dependent variables, right? Yeah? So a lot of it is quantitative research. But we have moved away from that all over the world for a long time and very slowly in India, where mixed methods, qualitative research, which is again informed by anthropology, gender studies, many other sister disciplines, and feminist psychology, which some mainstream disciplines are now taking to. And what is qualitative research? It comes from lived experience, where research is defined not as, all of us are used to this when we've sat in our research methodology classes. Please try and remember. We are told you have to be objective. Yes or no? You should not be invested in this. Wow. So if you are researching, finding solutions for something with which you're not associated, whether it's a master's dissertation, or in my department people have done undergrad research, they start young, and then postgrad, and then PhD, and so on. So it remains, insular research. And then we say there is a gap. But for a long, long time, many of these other disciplines that I gravitated towards from mainstream psychology, for my own sanity, because if you want to do people-centered work, like Connecting is doing, and I'm happy I'm invited here to speak and to critique mainstream, so I'll plug my book before I forget it. So things that I'm saying, I have put out all the evidence, so I'm quickly plugging my book. It's on psychology and gender. It's a Routledge, this is the Indian edition. So 2 less pizzas, everybody, that is the cost. The international, of course, is. So and it's South Asian, it's not just India or the globe, so it speaks to all of this. So this is coming from entire, sections and varied communities. So again, there'll be another question, but I'll just link what Raj Mariwala said. So again, when we say community-based research, the communities that we are going to pay attention to are the ones that we haven't paid attention to. Again, either in research or in practice, and Raj stole my lines, they're part of my prep. So we are now going to talk about, or at least hear researchers who are already doing this, Dalit, Bahujan, Adivasis, urban poor. So when we say community also, and I'm an upper middle class person myself, so yes, we are not saying that we do not want to do work with our own people, so-called. But that is something that has been done in research for donkey's years, all across. Privileged working with the privileged. Or another thing that Raj brought out, again, how do we imagine research everywhere? So there is something I hope people in the room are reading, following, decoloniality, decolonization. So again, side disciplines world over, and we are defining our own thing in South Asia. Because then people accuse us, isn't this entirely, North? No, it isn't. We are evolving our own multicultural thing. So again, I wouldn't say there are gaps between research and praxis, but they are between academic insular research, which continues in the same way. I'm a PhD guide, and sitting in on all the PhD work, and I'm telling you, it's torture, because younger people are told this is the only way to do academic research. So I can say a lot, but I'll stop by.
That's so put beautifully by Sadhna ji. I come from a school of social sciences, and interdisciplinary work is so critical. So whether you're looking at social work, whether you're looking at education, everything is interdisciplinary. And going back to what Bobby said about talking to the community and taking it back. Yesterday in one of the sessions, Irina said how you can co-create the solutions, and unless you involve community, otherwise the solutions are coming top down. You need to co-create those solutions, and therefore getting activities on the floor and back into the research lab and taking what has been researched back into practice is such a critical gap that we need to address. So Bobby, coming from the School of Social Work, How do you think we can integrate this into regular classroom and then into regular research work?
So let me illustrate this. Rather than speaking theory, I would like to bring it from the angle of practice. So let's imagine, I'll bring the example from the tsunami affected communities. You know that several years ago, 2003, when the tsunami happened, many communities in India, Indonesia, Sri Lanka were all affected. And one of the things which happened was that people who were having a very stable life suddenly found out that their complete properties have been destroyed, and they are living on the streets, and they have lost large number of community members. Lots of people were in distress, suicidal, they lost their dignity, sense of dignity, all of this. So how do you work with communities like this? So one of the approaches could be in terms of participatory action research approach, where you go into the neighborhoods, you listen to people, family by family, individual by individual, neighborhood by neighborhood, with a sense of SALT approach, like you can be very supportive of the community, appreciate all the strengths that you see in the family and in the neighborhood, listen to them, be a team with them, and also cultivate a team with them. So then what happens is that over a period of time, what you notice is that people are sharing with one another, not that we are experts coming from outside and they share with us, but they speak to one another, they listen to one another, they heal, and when they heal, they begin to rebuild the communities together. They begin to identify what are the vulnerabilities in their community. For instance, they will say that our single women in our community are very vulnerable because now they have lost all the family members and there are many men trying to approach them. So as a community, it is our responsibility to protect them, and we need to form supportive network around them. Our children who are orphans are very vulnerable because now they don't have anybody who will take care of them. And they also identify things like, when the support materials come from outside, we notice that it's only people living on the street side who get it, but not the people living in the interior area. So equal distribution of relief materials become important. Networking with the government becomes important. So through an approach of listening, SALT-oriented approach, by including the women, the orphans, the neighbors, the community leaders, the NGO representatives who are coming from outside, the government officials, in this whole process of dialogue of listening to them, what is the concern that you are dealing with? For example, the government official may look very cold and very distant to us, but when you listen to me, he say that I am really overwhelmed because the numbers that I am dealing with is thousands and 10,000s, and I have so much of resources only, and I really can't understand how to deal with all these things. I'm losing sleep in the night. So when you listen to that kind of perspective, and when he says that I really want to make a good contribution, I really want to do a good job and make sure that these communities heal and recover. I don't want to see people dying by suicide, which is happening here and there. So when you listen to that perspective, he also becomes open to us, saying that, like, I'm willing to work with you, and we are willing to work with you. So the community is no more fighting with the government officials, but they are understanding his perspective, and the government officials understand the perspective of the community members. So that way of approaching, it brings in data. When you do participatory action research, bringing in data from all the members, and when you do a thematic analysis together, then each person is able to see each other's perspective. When the community leader sees that, okay, this is what is happening with the widows, that's her concern that she is dealing with. For the men to see that, okay, now we are looking for a woman to marry, but then when we approach, this is what she is going through. So participatory action research really helps people to go ahead and improve upon the previous work, and the transdisciplinary approach of involving people also helps various perspectives to be brought in, work in, and develop better solutions.
Thank you. That's a useful insight.
So
And,
Janaki,
Sadhnaji, very quickly,
very quick, because I know time is at a premium. Okay, so I'll just illustrate the kind of model we developed in my college, my team, my students, alumni, all of us together over a long period of time, 33 years, and that it's become a informed pedagogy, which is again co-creation of knowledge. I'll very quickly just thumbnail. So we started a counseling cell 33 years ago, very small team, but within a month I understood that whatever you say, and one has been struggling with that for last 37 years, many of you sitting in this room for whatever number of years we worked in mental health, we are still yo-yoing between awareness and stigma.
Yeah.
You know, yo-yoing. I mean, I'm lost for words these days, so I just...
Yeah.
So, we started Disha, Speak Out and Peer Support Group, which is facilitated, led by trained students themselves. Okay, this is way before listening circle, etc., became a fad. This is 33 years ago. And through that, there is this tribe now of all these coordinators. And what are the thematics? It is what we say in Marathi, from the Bhava Vishwa of the youngsters. And we've all written on it. My students have written, my colleagues and I. So I can give you all those resources later. So I'll just illustrate, because the campus that I have worked in, Modern College Ganesh Kind Autonomous, is not an elite campus. Yeah. So rural poor to all across Zillas of Maharashtra, other states and Northeast, until 2022, international students as well. So an exceptional diversity, doing diversity psychology. So I'll quickly illustrate from Disha. So love Aajkal, very popular theme all these years. But what are the stories? Here's an Adivasi girl in that same group. She says, it's a luxury for me. What are you people talking about? I have a scholarship and I'm barely existing here, and I can't even look at a guy. And there are others who are doing other sharing, and then it comes to transgressive love. The intercaste, the interreligious, queer love. So that is Disha in a nutshell. So we have a speak out, then we have a write out, kaleidoscope, where they write in Hindi, Marathi, English. And that is thematic writing, first step to research writing. So then we have Khoj, which from undergrad onwards, because catch them young. They're so bright. And then they're told only at 22 at postgrad you come with a research topic, which is why then, and so on and so forth. So we have curated a whole lot of college community mental health. I'll quickly talk about Umeed, and I know we have to also illustrate about research, our own research work. So Umeed is taking self-care groups for our tertiary staff, and it's a lesson in respect. So they were also going out way before NEP, Koshish, which was internship. They came to Satyat Badana also. So we did all of that, and then the students started thinking that communities are out there where that NGO is working, correct? Yeah. So I said, no, we have a community right here, quite hierarchical, which is a microcosm of that large macrocosm outside, with all those hierarchies intact. So we started Umeed, which means hope, and they started taking these self-care groups with people, but it was a lot of learning for students and us. Okay? Because, and all of this people have published. So our students have published, and you can read it on Google Scholar, and have become co-creators of knowledge. So it's not just about me or faculty members for Academic Performance Index. That's one thing. But it is everybody writing and contributing. And ये सारा हिंदी, मराठी और अंग्रेजी में होता है. So we've not, So I'll stop here because there's
Sorry, we are running out of time.
Yes,
this is
we
a
have our
vast
last
subject. And just in closing, Just like how field work is very important for most students, and a lot of our pedagogy comes from the field back into the research, it's an excellent thing that if we can start it at undergraduate level itself and have field work built into the academic pedagogy, then when they finish, by the time they finish their post-graduation, they are a fully rounded product. They are have the conceptual skills, and having worked in the field, then they are not yet still looking for internships. They are ready to go out in the field by themselves. I think that is what, if we can build those gaps, bridge those gaps between practice and research, right from undergraduation to graduation, we will have more complete products by the time they finish their post-graduation. So thank you, Sadhana Tai.
We've come to the end.
Thank you,
But
Bobby. Very short time, but I hope we have done justice to the topic. Thank you so much, Aditi.
I'm sorry, I mean, she's moderating, but one just quick, of course, I'll share that with connecting people later so that it goes out to everybody. But everybody sitting in the room, are we aware of 3 resources that have come from WHO 2021, something in August 2025, and something else on 25th November 2025? No? All right. So this I think is a gap. There is some wonderful work and resources, but only a few of us who are doing intersectoral and intersectional work across movements happen to be aware. So there are these 3 wonderful guidelines with research, evidence-based research from across the world, which all of us can use for our own work, wherever we are located, whatever we are doing. So there's tons of stuff, I think, that is happening. We have to get out of our own comfort zones and challenge ourselves. I'm sorry I stepped in because I'm like, okay, there are so many resources.
Yeah.
All right, but thank you so much. Thank you.
Yeah, and please stay. Thank you so much, the speakers and moderator. I request Mridula, a volunteer, to felicitate the speakers and moderator. Thank you. Bobby. Dr. Sadhana. And Janaki as a moderator who had so much to hold in this space. Thank you. And now